Of the 8.9 million enrolled veterans in the VA healthcare system, 3.2 million of them live in rural areas of the United States. The Office of Rural Health is interested in ensuring that our veterans living in rural areas in the United States have the same level of access as every other veteran to the care and the services they deserve.
Rural veterans face healthcare challenges that many veterans face. What sets rural veterans apart is the issue of access to health care. One of the most significant challenges they face is transportation. They may have to travel quite a distance to get to the specialist or even the primary care provider that they need to see.
And in the communities where they live, there are significant shortages in doctors and nurses and other healthcare providers. So the Office of Rural Health is working to improve and increase access to care for rural veterans through our Promising Practices program, through rural provider training programs that train doctors and nurses who then go serve in rural communities, and a variety of other initiatives, including telehealth or telemedicine, delivering care over distance using technology.
It's really gone over quite well. Some of the older veterans that you would think would be a little reluctant have really embraced it and found it to be quite to their liking. And we're constantly finding new ways to use telehealth with telepsychology, telepsychiatry.
We know that in rural communities, there is often an absence of mental health providers sufficient to meet the need in those communities. So for mental health care specifically, VA's Office of Rural Health has funded programs that have helped in the following ways. 100,000 rural veterans have obtained mental health care through telehealth technology. 778 rural clergy members have been trained to better recognize post-traumatic stress disorder in returning service members and veterans. And 97 mental health student trainees have completed clinical rotations at rural VA facilities. Again, it's about access to services and about delivering that care to veterans when they need it and where they are.
I live in the country outside of Waynesboro, Pennsylvania. This is extremely convenient for me. I don't have to drive an hour and a half down to Martinsburg compared to just driving like 20 or 30 minutes to here. My healthcare providers are extremely nice, which to me makes a world of difference. The nicer they are, the better things go. Have a good day.
At the Department of Veterans Affairs, veterans are our #1 customer. They are our priority. And so success is veterans being able to access their care in their rural community. Success is rural veterans being able to access the specialists that they may need. And success is really bringing together all the best pieces of a community and the larger VA healthcare system to support and care for that rural veteran.